How to stop the spread of COVID-19? The simple answer is to practice social distancing. And this means everyone: healthy people, young people, elderly people, those with underlying health conditions. Everyone must practice social distancing. Now, this term, social distancing, has been thrown around quite a bit in the media recently since the onset of this coronavirus pandemic. But what exactly is social distancing? Social distancing, according to Johns Hopkins Medicine, is deliberately increasing the physical space between people to avoid spreading illness. Now, the White House has asked us to stay, I should clarify, all of us to stay at least 6 feet away from others to practice social distancing. And some examples of social distancing would be avoiding large gatherings. I think now most governors have issued gatherings of over 10 people to be banned, um, canceling face to face meetings, working from home, only leaving your home for essential items, and canceling all non essential travel plans would all be examples of social distancing. And really, the second bullet from the bottom here, only leaving your home for essential items, is very important. This may seem extreme, but if we really want to curb the spread of this virus, that's what we must do. Now, everyone must follow the guidelines, like I said, not just those who are susceptible, the elderly with underlying health conditions. Everyone must follow the guidelines, even if you're a healthy, spry college student. Now, different models have been made predicting the outcome of the novel coronavirus here in the US. Now, if we do not follow social distancing protocol, the worst case model predicts for 2.2 million deaths in the US alone, versus with social distancing, self isolation, different stay at home orders, all these distancing measures and protocols, we would see still 100,000 to 200,000 deaths nationwide, which is still a huge number, a number that I personally am shocked by. But that's the way it is. So, to make sure the scenario on the left does not play out, we must practice social distancing. Everyone must follow the guidelines. And if we can make these measures, if we can follow these measures, supplies in hospitals should be much more readily available. People who need care should be able to get care, because the idea of practicing social distancing is to flatten the curve. Now, this has been kind of a catchphrase in the media these last couple months, but what we're trying to do is flatten the curve down to mitigate the extreme case where hospitals are just completely overrun. Um, they don't have enough beds, not enough supplies. People are just dying at the hands of this virus because they cannot get the help that they need. We don't want that curve over here on the left in the red. We want a flatter curve, which will prolong the impact of people getting sick, but it should ensure that people who need care can get care. So the bottom line is to stay at home unless you absolutely must leave. Really, at this point, you should just be going outside, maybe for some fresh air, go for a short walk around your neighborhood, um, go to the store to get groceries, but that's about it. And there should be no playing around, visiting people. If you're going to visit people, stick to the phone, Skype, FaceTime, do it online. And finally, just a last call to the healthy people out there. Just follow these guidelines. It's going to help everyone get over this virus, and the sooner, the better you follow these guidelines, the sooner this can all be over. I think my worry is that young people, maybe middle-aged people who feel that they're in good health, don't follow these guidelines, and here in the U.S. we're just kind of stuck in a middle ground where governors have issued these orders. People are being asked to stay at home. Certain parts of the population are, others aren't, and we're really just in this middle ground where everything just kind of sucks. We don't want that. We want to save lives and get this over with. So thanks for listening. I hope you learned something.